Welcome, everyone. For those of you who are visiting, my name is Sal Pizarro. I'm the president around here, and I'd like to welcome you to the 5,391st meeting of the Rotary Club of San Jose. As you probably saw, we had our shutterbugs out in the lobby welcoming us, the photography committee chaired by Carl Silker, who is currently taking a picture of me. So that's how that works every week. Carl will be up here to talk a little bit about the committee and what they do and how you can join them, I think. It doesn't take much. You can just look at some of the people they've helped along, and their photos are always beautiful, as we see during the week. Next, if we could have our red badgers with the traveling mic stand up. I see them both. Why don't we start over here with you, Chuck?
Hi, good afternoon. I'm Chuck Cantrell. I am the development director at the San Jose Conservation Corps. I'm also a planning commissioner for the city of San Jose. I've been with this organization for 2.5 months so far, and I love it.
Fantastic. Welcome, Chuck. Thank you. Dave, you love this job.
my 30 seconds of fame. Good afternoon, President Sal. I'm Dave Cowan. I am a sales trainer, and my sponsor is Ed Correa.
Great. Okay, if we could have visiting Rotarians and Rotarians with guests, please stand up. We'll start with Maggie over here.
Thank you. Thank you. Hello, President Sal. Please stand. I have two students with me here today. One of them is a student of San Jose State University, Rotaract Club, but I'm going to have her introduce herself.
Hello, my name is Tammy Cow. I am a public health major at San Jose State. Yeah.
Hello, my name is Sehjleen Kaur Bhatia and I'm from Dienza College. I'm majoring in business economics and I'm interested in joining the Rotaract Club of San Jose State.
Thank you.
Welcome.
Thank you very much.
Hello, Mr. President, Ron Zrake. I have two guests with me today. Nicole Leckler, she is the Director of Membership at the Silicon Valley Capital Club, and Ann Webb, who is retired from IBM.
Great to have you, and wonderful to see you here. Is that it? Okay, that was fast. All right, well, thank you to all of those of you who are joining us today and those of you on Zoom. I do have some sad news to share. Fred Begun passed away unexpectedly this weekend. He'd had a revision hip replacement surgery a few weeks ago. His wife Sherry was with him Saturday night, took him to Good Samaritan Hospital. They don't know, or at least at the time we heard, what the exact cause of death was, but it was believed to be a heart attack or a blood clot. Probably related to the surgery. And of course, Fred, longtime member of this club, and just a great guy if you got to know him. We will be scheduling a eulogy for a later date, but there is a celebration of life planned for him next Tuesday, May 16th at noon at Campo de Bacci in Los Gatos. It is open to everyone, no RSVPs, it's casual. Sherry says, wear your favorite party clothes to celebrate Fred's life. So we'll include that information in the bulletin, of course, this week, so you can all go out there if you'd like. And I'm going to ring the bell in his memory for now and ask for a moment of silence. Thank you. All right, moving on, I want to bring up a special guest. So we're having a special sort of taste of San Jose today. And I would like to ask Casey Hill, who is Executive Director of Vegilution, to please come up and talk to us about Vegilution and tell us what special prize our members can enjoy today. Casey.
All right, good afternoon, everyone. I've been reminded to lean into the mic. Can everybody hear me? Okay, excellent. Thank you so much for having me here with you today as part of your Taste of San Jose series. This is a little bit different, but I think you'll get it once we get started here. And what I'm going to tell you is, well, I'm not going to tell you, I'm not going to say what the prize is quite yet. We'll get there. Okay. But first, what I'm going to do is introduce myself, Casey Hill. I'm Executive Director of Veggielution. We are a nonprofit organization based in East San Jose, and we focus on environmental equity, food sovereignty, and community engagement. I'm going to tell you a little bit about that. All right. Nope, that's right. Okay, I see what we're doing. Okay, so I'm not going to spend too much time on each of these slides because I have a brief amount of time, but what I do want to say is that some of you may know Veggielution already. We're located at Emma Prush Farm Park. Raise your hand if you know Veggielution, or maybe have been to, all right. Yeah, that's amazing. Okay, well, you may be familiar with us as a 6-acre community farm that operates at Emma Prush Farm Park in East San Jose, and that is true. But what I want to share with you today is that we have grown, we've expanded our staff, our budget, our reach, and right now, what I want to share with you is how we envision ourselves and the partners that we work with and the community that we're in as part of a local food system, and we want to create a more resilient local food system. And we do that through several different programs. You may be familiar with some of these, but Eastside Grown is our food entrepreneurship and advocacy program. Through Eastside Connect, we distribute over 300 farm boxes packed from local Santa Clara Valley BIPOC farmers here in our region, organic produce that goes to our East San Jose families in the area. And we're building a climate resilience food hub. I'll tell you a little bit more about that. And we provide environmental education programs. During COVID, now that we're coming into what I guess we would describe as our recovery phase, although we know that there are still so many families that still need access to fresh, healthy food, Veggielution was part of a huge, as you all know, citywide and countywide pivot to address the needs of our most vulnerable residents. And at that time, Veggielution connected with 10 local farmers in the Santa Clara Valley area to pack over 300,000 farm boxes with the help of many people just like you, community leaders, volunteers, community members, and we flowed by way of that project $7.5 million to those farmers to purchase that produce. So this is an effort that feeds families, supports farmers, and builds jobs in our local community. We have a vision of growing those efforts now that we've built a little muscle around it, understanding how we can do more of that work into a community food hub. So we're thinking about how do we not only build in that infrastructure to pack and distribute boxes, but how do we store it effectively? We've installed a solar cooling unit that's powered by solar. It's completely off-grid so that it's ready in day-to-day and in times of emergency. We're thinking about how can we bring in more of our local food entrepreneurs to be part of that effort as well. So you're going to see a lot more about this and hear a lot more about our community food hub project over the next couple of years. That means that we're growing the community to which we're connected at farmers. We're building more policy connections, so keep that in mind if any of you out there have connections to food system policy. And we're going to continue to grow jobs because we know that food system jobs, resilient food system jobs, are green jobs, and jobs that allow people to work closely to where they live are green jobs. This is what it looks like. This is our beautiful Veggielution hub manifest in a few excellent photos. And I want to end on a note that is very celebratory and connects to that place that you just saw some beautiful pictures of, which is on June 11th. We'll be hosting our fundraising event. It's called Feast. Notice that all the East in Feast is capitalized. That's very intentional. It's located at our farm in East San Jose, inside of Emma Prush Farm Park. It's a lot of fun. We happen to have this amazing MC you might know to lead us through the festivities, and we gather about 250 local community leaders, elected officials, our neighbors, friends, nonprofit partners, funders, to just celebrate the beauty of community food systems and the work that we're all doing to support that. So now I'm going to announce the exciting prize that we have. Or Sal's going to do it.
Well, no, you're going to do it.
I'm going
to set them up by saying, so normally when I do these Taste of SJ things, I bring in I tell you about some place that provides food to our community, usually something really sweet or savory, and I bring in a sample that I end up challenging someone to some way to get this sample. Now, so my vision was that I was going to have Casey come in here and tell you about Veggielution, because I had a feeling a lot of people didn't know about it, and bring in a box of their produce. And then I found out they packed those boxes on Friday. So you would have had a box from last Friday that would have had a bunch of rotten produce in it. And I thought, well, that's no good. So she came up with a better idea. Tell us what your idea was.
Okay. So I said, well, in the spirit of Veggielution and many of our nonprofit food partners, connecting food and what is our beautiful Santa Clara Valley's bounty to place, right? I said, why not raffle off this or auction off this farm box? But the requirement is you have to come pick it up. So you can pick it up at the farm on Friday. You can pick it up on Saturday. If you come on Friday, I will throw in lunch on me, because I want to tell you more about Veggielution, of course, and we can take a farm walk. So there's a whole package deal in this that we're offering.
So what you're going to get is this business card of Casey's that says on the back, and you couldn't reproduce this yourself, okay? It says, free farm box, pick up Friday or Saturday, and I think it's signed by her. So you can't, don't try to make this up yourself. But I do want to raise a little bit here. So this has, this is a priceless value if you haven't been to Veggielution, but there is a real value to the food and to the farmers who have grown this food. So I would like to see, does anyone want this package, including lunch if you pick it up on Friday, for $25? Sashir, okay. Anyone want $30?
We are flexible on the Friday.
Could be Friday the 19th. I saw my wife back there, $30. 35. 35, Steve Prouty. 40, Catherine. 40. 45, Dave Peterson. 50, 55, Catherine. 55, 60, Steve Prouty. 65, Sarah Janigan. 65. Anyone want to go 70? $100, Dave Peterson. Anyone wants to beat Dave Peterson $100, call out your number right now. And it better not be 101. Okay, Dave Peterson going once at 100, going twice. Sold to Dave Peterson for $100. Thank you, Dave. And thank you, Casey. You can go down there and hand it to him, and you are done. Thank you for sharing with us. Oh, don't forget this one. I will keep that. Yeah. Well, and we'll raffle that later, too. Okay. So another fun event coming up this week we wanted to share with you. Originally, Eric Glader from the Urban Vibrancy Institute was going to be here to talk about this. Turns out his son's graduating in Boulder today. So he was like, oh, I'm supposed to go there. And we talked about doing it on Zoom, and I said, don't worry about it. I got it. The Downtown Development Committee already knows what I'm talking about because Kathy Collins shared a post about this already this week. But on May 18th, there was a block party in downtown San Jose. Got a little video to show you. It's in the historic district, which is around Fountain Alley. Let's see if we get this going. Okay, so did that. That was nice. All right, so this party, you saw that whole list of businesses go by. There's apparently like what they consider 50 retailers in that whole area, counting dining and shopping establishments like Carl Salas's favorite store, Hammer and Lewis. That's one of them. But this should be a really fun event. It's free, at least it's free to attend. You'll be able to buy food and drinks and go to some of the businesses there. Eric said he really wanted to see Rotarians involved because he feels like we're influencers in this community. He also wants to see City Hall, more City Hall people getting down there because he thinks they aren't very aware of all of the businesses and opportunities that are downtown. So we just wanted to open this up to you, let you know about it. We'll be sharing information about it again next week. I'll be out there and it should be a lot of fun. So hope you can join us. All right, next, Carl Silker. Put down your camera and come up here onto the podium.
Well, thank you, Sal. You folks have all seen our photography committee at various times. We're always here at meetings and sometimes at our off-site events. And so we have a very small but a dedicated group of photographers, and we could use some help because we had about 3 additional photographers prior to COVID, but due to retirements and people moving away and things like that, our numbers have shrunk a bit. So we could really use some help. So if you have an interest in photography, and if you have a camera, because we need that in here, the cell phones really don't work as well. We should be interested in having some help. And so just connect with me when you can. And then the other part is every week we shoot pictures, we upload them to Flickr, to the SJ Rotary Flickr page. And we've got years and years of Rotary meetings and events there that you can peruse and download whatever you want to do. Thank you.
And really, if you haven't done it before, go through and check out some of those photos. It's like reliving some great memories, honestly. Next, he already knew he was coming up. Fernando Sessueto. So few chances at the podium.
Yeah, well, I don't have anything like urban or the vibrancy committee, but I am here to tell you to please save the date of August 19th. That's when Richard Alejandro, Terry Chapman, the Disaster Relief Committee, and your Rotary Club are going to participate in a, oops, there's a labial plosive there. You're going to participate in sending help to the victims and the evacuees of the Pajaro Valley that suffered the flood damage in March of this year. Now you may want to know, well, if it happened in March, didn't they get help? Well, they did, they got some help, but basically people tend to forget quickly, especially if they're given once. And it's human nature to let that one go, but no, the problems are still there. They lost everything. They lost their food, their cars, family photos, clothing, important papers, all lost because there was about 3 or 4 feet of water throughout this little municipality of about 3,000 people. And they need help, and that doesn't go away. It's not something that's easily remedied, but we can try to help. And we're going to do this August 19th. We're going to call upon you to help us, to hear from Terry Chapman, to hear from Richard Alejandro, myself, and others, to see what we can do, get box trucks to collect the aid and see if we can give these folks some relief. That's really something that all of us can understand, and just takes time, sometimes months, sometimes a year, 2 years. So August 19th, it's a Saturday, and we will be planning all of the details, but I wanted you to at least have the time now to put that on your calendar so that that takes preference. Thank you. But Richard Alejandro says that we should expect 50 to 60 vehicles, making it a caravan to just on the other side of the Pajaro River from Watsonville. But Richard's going to take care of that particular detail, I can assure you. Thank you very much.
Thank you, Fernando. So mark your calendars for August 19th. Now, you remember when Darlene Tennis is here and talked to us about the farm worker caravan and the work she'd been doing at that point in the Salinas area, and a lot of it shifted to Pajaro now. She challenged me. She said, you know, they've got Santa Clara University and other organizations doing these. And she said, boy, I would imagine that the San Jose Rotary Club, everybody I saw, you guys are all committed. I imagine you guys are going to have the most people then and the most donations. And I said, well, that sounds like a challenge. And I'm sure then President Karen Philbrick will be able to rise to that challenge. So help Karen out to look good, and you can participate in that August 19th. I'm sure I will very possibly be there myself. One place I will be, and I hope you'll join me, is we do have our Rise Against Hunger event taking place on May 20th at 9 a.m. We still have plenty of room for signups right now. You won't get a t-shirt out of it, unfortunately. We've already, we're putting in that order. Leslie, have we put in that order yet? We have put in that order for t-shirts, but you can still come out of the goodness of your heart. Right now, from what I understand, the number of volunteers we have, it's going to take us about 2.5 to 3 hours to accomplish this. So the more people we have, the less time that's going to take. So if you can sign up, let Leslie know, or I don't know if we still have a sign up out in the lobby. We do, but please try to join us. That's on May 20th, and it should be a good time and hopefully a fun way for us to help the community. Also coming up, speaking of fun things, we've got our spring barbecue on June 14th at History Park once again. Of course, we're going to have Bert's wagon out there. I just saw a typo here. It says enjoy President Sal's Manhattans. It's not going to be my Manhattans. I'm actually going to be serving hurricanes so that we can let the good times roll. It's going to be a limited number, so first come, first serve. It's not going to be a small number, but it is going to be limited, and don't come back for seconds either. And of course, we're going to have all the usual appetizers and the dinner. We're going to have our classic cars on display. The price is $70 per person, and I would like to advise you when we start signups next week, bring your checkbook, because we're trying to save on credit card fees right now, and that is really helpful. If you can pay by check, we avoid the fees of like 3%. When we are working on our budget, little inside baseball for you if you're not on the board, when we're working on the budget, there's a line item for credit card fees, and it is insane what they charge. And you can help us out a little if you can pay by check. But if you can't, that's fine. We'll take it anyway. So we'll be signing up next week. We'll be hearing from the executive chefs at some point to get you very excited about it, but I can't wait to see you on June 14th. Now, if I could have Richard Aljuni come up to introduce our program. Richard.
I'm not sure if you guys are clapping for me or Sal, but round of applause for Sal, President Sal. Reymundo Espinoza. His career was built on a bit of luck and a failed eye exam. You see, his first choice was West Point. However, he attended Stanford University, the second choice, because of his failed eye exam. This community is very fortunate that Reymundo has poor vision, but he has a vision. He was raised in Coachella, the son of a farmer and a homemaker, saw a lot of trauma at a young age, and I think that trauma is what catalyzed him to go into healthcare. He continued his education at UC Berkeley, where he has earned an MPA, I think? MPH, excuse me.
Hospital
MPH,
Administration.
Master's in Public Health and Hospital Administration. He worked for private healthcare, in a private healthcare environment for a few years, but in 1986, he took over a fledgling community health center with a $2.5 million budget and 1 clinic. Today, that enterprise has an $80 million operating budget and 11 sites in Santa Clara County and 1 in San Mateo County. They will serve nearly 50,000 patients, unique patients this year, and the number of encounters is much higher. That's right, 40-some thousand unique patients.
Yes.
They offer a full spectrum of primary care, pediatrics, women's health, optometry, pharmacy, dentistry, behavioral health, nutritional counseling. 79% of the patients are Latino and 98 live below the federal poverty line.
Yes.
Reymundo is retiring at the end of the year to spend more time with his wife, Bea, and his adult daughters, who both went into healthcare, by the way. It's the family business, I guess. He loves to garden. He's a diehard Raiders fan.
Oh, no.
And I heard he once jammed with Sheila E. on stage. Is that true? Do we have any drums here? Or we're going to skip that? Okay. Thank you, Emily. Reymundo.
Hi, everybody. I'm Emily Robin. I am newly Blue Badge, and I'm on the program committee. And the reason, I think, why I was invited to have this Q&A session with Reymundo is that I'm a healthcare provider myself, and so I have a little bit of a context for some of the issues that we're going to be talking about. And apparently, you guys all trust me to ask relevant questions, so we'll see how this goes.
Okay.
So I'll just start by saying that our objectives for this session are for everyone here to understand a little bit more than you might already know about what community health services are and describe this concept of healthcare access and social determinants of health. I hope you'll come away having learned a little bit about that. And then I also hope that you'll come away from this being really inspired to participate in our club's development of a mobile health unit and any other community health related activities that we might participate in. So I've introduced myself and you guys all know me, but why don't you tell us a little bit about yourself and maybe how you became interested in healthcare administration to begin with.
Okay. Yeah, my name is Reymundo Espinoza. I'm the CEO of Gardner Health Services. How I got involved in in healthcare, well, it was traumatic. My upbringing was traumatic. My mom was in a mental institution when I was 10. My sister died of toxemia when she was 20. Later on, my brother died at 34 from a heart attack. My sister committed suicide at 28. So there's a lot of trauma there, right? And so for me, and of course we were poor, and I didn't realize it till I got to Stanford. Because everybody around me was the same, so we were good. You know, we were rich in that way. But I think that experience really created a desire to do something in health. I wanted to be a physician, but you got to understand that was during the 60s, and I wasn't that disciplined. Because you had a lot of movements going on, right? You had the civil rights movement, the Cesar Chavez movement, the war in Vietnam, all of that. So eventually, like I said, I think I've been a blessed child all my life because, like I said, my second choice was Stanford. But in this situation, I happened to get into the School of Public Health as a result of a by chance meeting we had with a friend in Guaymas, Mexico, when I got married, because I got married young. And he said, what about this? Think about this, because my friends went into becoming an attorney or a physician, and I didn't want to do either of those. And then I said, oh, hey, this sounds great. Let me try it. So I got into the School of Public Health.
Can you tell us a little bit, like, what is Gardner Health Services? I don't know that all of us, pass by a Gardner Health Services clinic on the way to Rotary meetings like I do. So tell us about Gardner Health Services and maybe more broadly talk about community health services in general. Like, what is that?
Yeah, so in general, just big picture, let's start with the big picture first. In Santa Clara County, there are, I want to say, 339,000 individuals who meet the 200% of poverty criteria and below. So that's a family of four making, $55,000 a year. And that's our target population. In addition to that, there's 10 health center corporations who also target nonprofit health center corporations in addition to the county who target the population to provide services. Overall, the community health centers, the 10 corporations see 160,000 patients, for 813,000 visits. There's 39 clinic sites, and 70% of the individuals are at 200% of poverty, which is the $55,000 or less, and 63% are Medi-Cal. Gardner, on the other hand, sees about 46,000 patients, about 136,000 visits. We have 11 sites, 7 are health centers, and 2 mobile units. Fortunately for us, we own 7 of the health centers, and 5 are debt-free because we started young and early, and we started buying because we didn't want our expenses to increase because we were so poor. I mean, we have stories about calling our funding source and say, don't mail the check because we got to meet payroll and we got to pick it up. You know, we were so poor, we started at a budget of about 2.5 million. And we provide, our goal is to provide services that are in a fashion that's comprehensive so that a person can come to quote unquote a one-stop shop. And some of our centers have more than others, but in general, we provide medical, dental, optometry, pharmacy, healthcare to the homeless services, throughout, from Gilroy to Redwood City. And the majority are here in the downtown east side areas.
So who are these patients who are using community health services as opposed to Kaiser or some other, you know, private company?
Well, I think the first thing that's important is that these were really, the health center was born out of two grassroots efforts because there was no access. Some of you probably remember that this was the Valley of Heart's Delight, right? And in the summer in Alviso, the population, the migrant workers population would double. And in the downtown community of the Gardner community by Sacred Heart Church was another enclave of immigrants. So this is an immigrant story of people not having access to care and wanting to make a difference. And so they organized with the local Catholic Church, the activists, and Stanford Medical School to provide services. One began in '68, the other one in 1971. The '68 was more for the migrant workers. The downtown was the cannery workers, the service workers. In 1997, we brought them together, we merged them to create what we currently have. At that time, in 1997, I believe, our budget was 21 million, and today we're at 80 million. The thing that's, so that's really important because we're actually patient directed. So the majority of our board members are patients and provide us guidance. And of course we have expertise from other members who provide us some financial expertise and program expertise, but the majority of the patients have to be patients. Some of the statistics for Gardner is 90% of the families are at 150% of poverty. So that's a family of 4 making $45,000 or less. That's 90% of the folks. 26% are uninsured. 57% have Medi-Cal. 79% are Latino. 19% are non-Latino, which include Asians, African Americans, American Indian populations. 52 speak Spanish only. 43% are from 0 to 18, which are, kids, 18, but 49% are 18 to 64, and 8% are 65 plus.
A lot of times we talk about this phrase, access to care, or people having lack of access. And I think on the surface that it sounds like people are just saying they don't have insurance, or maybe they don't have a physical way to get to care. But access is so much more than that, right? It's having a healthcare provider who can align with you in terms of the language that you speak, being embedded in the community. Can you talk a little bit more about this phrase, access to care?
Yeah, well, so when the organizations first began, access was as a result of distance, language capability, fear of the government, because some were undocumented and were working here. But the big issue was that there was a healthcare crisis for the immigrant populations. I mean, there was a doctor, I think at Silicorn, that did a study in the Gardner community that identified some of the same things that we're experiencing now, but overcrowded living conditions, 10 people living in a 2-bedroom house in the downtown area. So to be able to be comfortable, to be able to be seen in a way that they could understand, to be able to be seen in a way that connects you, because I think that's our strength. Not only was it, so the big picture is healthcare is just the means to another end. And that is to have a healthy and viable life so that you can fulfill your dreams. Because, so in that process, they have to make choices between food, transportation, healthcare, living. And so what we try to do is connect. So you come in for the healthcare, and if you need multiple services, we'll provide them, but we try to connect you to food, we try to connect you to housing, we try to connect you to all those things which are now called, quote unquote, the social determinants of health, right? Anything in your environment that impacts your well-being. And that could be economic stability, that could be education, access and quality. So the biggest determinants of health are education. Why? Because you're better off if you get an education, quote unquote. Housing, the unhoused are less healthy than the housed. I mean, so those are some of the social determinants of health that we, even though we concentrate on the physical and mental health and well-being for the individuals, we advocate at a broader level to try to address those issues as well. And it's a challenge, but I think those are the things that are going to make systemic change in the future.
I work in an emergency department at a children's hospital near downtown Oakland, as well as in San Francisco, and we'll find that we're working in the middle of the night. It's 3:30 in the morning, and a whole family comes in with a complaint. This is the emergency department, and it's something like the baby's had a rash for 2 weeks. And I've now been doing this job long enough that I understand a lot of the factors that go into why families are seeking care in this format, because even though it's 3:30 in the morning and that feels like the middle of the night to many of us, that's when the single working parent came home from their second job and the only car that they have available is free to be able to come to the emergency department for what is essentially a primary care visit. So I feel like community health services are providing those types of services more and more, and there are just like pockets where that's it's just not available. And so then the sort of safety net is the emergency department, probably in the middle of the night.
Yeah. So there's 339,000 of those, okay? Of us in the community, in this community.
It's a lot.
It's a lot.
It's hard. It's a big teaching point that we talk about with the trainees. I'll work with a resident physician maybe who literally is rolling their eyes about, oh, this fever times 3 weeks, wonder what they're doing here at 4 a.m. I'm like, hold on a second. Since when have you seen a primary care office open at 4 o'clock in the morning, and that's the only free time they have? So I think it's a really important thing to talk about. And I want to talk a little more about this concept, social determinants of health, because I think many of us are familiar with that phrase, but not everybody has as like personal of experience with it. So non-medical things about your life that then affect your medical outcomes.
Right.
So for example, you may live in a certain zip code and that gives you a higher mortality rate from certain diseases. Maybe there's a higher prevalence of hypertension in that chronic disease in that community. Can you kind of talk about that a little more, and like how you feel like Gardner is impacting that in the community?
Well, I think just to react to COVID really demonstrated the impact. Those issues were always there. The healthcare issues were always there. I think COVID just exacerbated the situation because you had more positives and more illness and more deaths on that. For example, in certain zip codes, and the East Side was one of them. Why? Because it impacted respiratory diseases, right? And the poor had, and because people were living together, it kind of like started to impact others, right? So I think the COVID just created a spotlight on problems that were already there and continue to be there. And I think that's why we're trying to make an effort to continue the momentum and the lessons learned as a result of the pandemic. Yeah, so, but repeat.
I think that the way you were talking about how the Gardner Community Health Services really
Oh, yeah.
links things together.
Yeah, so in that situation, because we saw a 30% positivity rate on the east side, we came together with a partner that we had never worked with, which was the School of Arts and Culture. And with the county's help, our assistance and the School of Arts and Culture, we created a vaccination and testing program that saw 800 people a day, which was unheard of in the area, right? We ended up doing thousands and thousands of vaccinations, but that's our role, to make a difference in communities and take immediate action when they need to. I mean, for me, I mean, it was a situation of, because partners, it's challenging because it's about how are we going to fund this, right? And I just had to go to the School of Arts and Culture, says, don't worry about it, I'll find the money, let's just do it. And that's what we had to do. And I found the money, fortunately, but again, our purpose is to make a difference in the lives of people, and we try to move as quickly as possible to do those things, and especially in emergency situations.
I've heard, we use the phrase social determinants of health, and when we write it, just kind of make it an acronym, SDOH. And some people have started to shift that D from the word determinant to the word driver, because determinant feels extremely final, like this is your destiny, whereas driver sounds more like something that could be influenced or changed. So do you think we should maybe start refocusing our terminology and talk about drivers of health instead of final determinants?
I mean, I'm okay with either myself. I mean, because at the end of the day, it is what it is, and we're trying to create a change, right? So if it's a driver, I'm okay with it. For me, I think what we do about it is important, and I think you're going to see in the future an effort as a result of this partnership that we developed with the School of Arts and Culture and La Colectiva, which is, which Vegelution is part of. The plaza became a place where you could get food, you could get vaccinations, and you could get other services for the community. So recently we partnered they asked us to be a partner in purchasing a facility across the street where we're going to begin to provide mental health, primary care, medical dental services at that site in collaboration with their programming for the arts and education in the School of Arts and Culture. But that's just the initial phase of the development. When we talk about the social determinants of health, this project over 10 years, maybe 15 years, is looking to deal with some of those social determinants of health by providing housing, because if we're not impacting the lived environment, we're not doing our job. And so we're trying to make change, and we're trying to impact the environment so that people in that community can stay in that community. We're becoming gentrified. All of us know it, and we want to be a part of the effort to keep our communities safe and hopefully whole as much as possible. And I think this is the first phase of that project where we start to deal with those different issues.
I didn't prep you with this question, but I know you'll be able to come up with an answer. So when you talk about the work that you're doing and making improvements in the community and improving people's health, that speaks very much to like my personal goals, why I went into medicine in the first place. So this sounds like an amazing place to work. Like I want to work there. I want to be a doctor there. Do you find that it is hard to get physicians and nurses and other staff to, what's the barrier to so many providers lining up at your door to work for you?
Well, first let me say I'm very fortunate. Again, I'm a blessed child. Fortunate that over the years that I've been here, many of our staff have stayed. I have people here 20 years plus. I would say 10% of our group. That's 620 people. So we have even one that's been here 50 years, okay, who started in 1968 in Alviso and still remains in Alviso and is still working with us, right? The challenge is that they're retiring, just like moi. And so the challenge now is that it's become even more competitive to pay the wages that we need to pay to be competitive with, quote unquote, the big boys, right? The Stanfords, the counties, and people that pay at a greater level and have we have decent benefits, but we're not there at the wage level that maybe we need to be, but we're getting there. But that has been a deterrent in terms of turnover, because people take because there's a shortage. Front office, what we call business office clerks, back office, medical assistants, therapists. And because we have bilingual, bicultural trained therapists, they're being sought after, right? And to counteract that, we're trying to do, for example, we have 35 interns going through our system. So we're trying to create a funnel from the community to us to hopefully create not only some professionals for us, but also for the community. But that is the biggest challenge that we face right now, being able to recruit certain positions. And like I said, I've been fortunate that people have stayed with us. But yes, it's getting more challenging.
Okay, we're running short on time, so
Okay,
I want to shift gears a tiny bit.
Okay.
I want you to tell us a little bit about the mobile health unit, but more importantly, as I've told you, our club's next big project is mobile health unit. And actually next week at the Rotary meeting, you'll be hearing a lot more. So definitely come to hear more about it then. But can you tell us, give us some words of wisdom as we're embarking on this project, pitfalls, challenges, strategies for success with a mobile health unit?
Well, let me just say our mobile unit, we have 2 units. We see 1,800 unhoused patients for 3,000 medical visits, 585 case management visits, 172 substance abuse visits. We're in 23 locations throughout Santa Clara County. But some of the issues, one, operational funding. How do you generate the operational funding? Because usually healthcare to the homeless, it's hard to, even though they may qualify for Medi-Cal, you're not going to necessarily collect it. So how do you maintain a unit? And it is expensive because you're paying, and part of it can be volunteer-based from that perspective, but to the extent, you still have to need some operating funding, and how do you maintain that operating funding? That's one. The second one, oh man, hate to say it, but the city's cumbersome. We had Indian Health Center has had a mobile unit sitting at its parking lot for 2 years because it can't get a permit to operate throughout the city. And more recently, they got a permit, but every time they go out, they got to pay $800. So if you can help change the policy at the city, I would appreciate it. And it doesn't make sense because you're trying to help the homeless, yet they're charging you as if you're a vendor or something. I don't know, right? And we're just trying to make a difference and help people and hopefully connect them. That's what we want to do, connect them. So if you can help us with the city, that would be great.
That's good advice, a lofty goal. So my last comment is, you've been CEO of Gardner for 35 years, and as we've heard, you're retiring, which is very, very exciting. It's really hard to wrap my mind around the tremendous number of patients that your work has impacted. It's really, compared to what I do, which is see one patient at a time and just hope that that rash goes away and then just move on to the next one. Your work is a lot more vast and sweeping across the community. So I just want to say thank you very much for the tremendous work that you and Gardner Health Services and a lot of the community health services have done. And I would like to know, do you have any words of wisdom or advice for your successor?
Grit, creativity, because you got to have it. Vision is important. What do we want to do? We want to create a system of care for everybody. We want to connect people, not just to what we have. You need to be able to work with partnerships. We have several. We have the School of Arts and Culture. We have the county. We have Lucille Packard. So we have a number of partners, and I think that's the way to begin to address the need. If you look at it, what the pandemic demonstrated to us is that as a group we could make a difference, and I think that's the new future. If we can come together as a group of providers and entities and service providers to address issues in the community, I think we're going to begin to make a difference. So to me, I think that is a part of the vision that is really important. I think advocacy is also important, not only for health, but the social determinants of health. It's never ending. but to the extent that I can help at least support low-income housing, we'll do it. If we have to come in, for example, we may have differences of opinion here, but from our perspective, the airport was a big issue, and we advocated to eliminate the airport because of the impact around the community, which the community wanted. I mean, those are the types of things that we're going to, get involved in and continue to develop the system of care. And there's gaps. There's gaps. Even if you have Medi-Cal, there's gaps. I'll give you an example. They won't pay for a dietitian to see a diabetic because the program only allows a dietitian for a person who's pregnant, right? Medication, we have low-cost medications, and for the normal person, the medications would be $800 a month. The discounted rate is $250 a month, but they still can't afford it. And that's for diabetes, right? And that's one of the biggest problems we have. So, how do we fill the gaps? How do we continue to make a difference? How do we get kids through our system a desire to continue their education? I mean, success story. We just hired a nurse practitioner who wanted to work at Gardner, lives 2 blocks away from Gardner, and was a Gardner patient, and came back, right? So those are the types of things. And I've run into people, the other day I ran into, at an event, a young lady, she was young, she was an attorney. She says, yeah, I remember Gardner, I remember your mural. Because nobody else would provide services to us. So I think the pandemic demonstrated that we have a place, that we have an ability to access, and we have an ability to make a difference. And so I hope that all of you continue to support institutions like Gardner, because we're here to make a difference. And like I said, you need grit. I mean, there's been many times when I've just like, oh my God, what am I going to do? And I found a solution some way. and I have stories, but there's no time to tell stories here.
Well, your retirement is leaving very big shoes to fill, and we're really appreciative of you being here. We're happy to take some questions, probably mainly for Reymundo, but if anybody has a question for me, I'm happy to answer as well.
I'll start with a quick question. Have any community health centers ever tried to introduce like a commercial product to supplement those who are poor and uninsured?
We have some. It's by like 1%, but for us, because we're an FQHC, our best payer is Medi-Cal, and so we try to see as many Medi-Cal. Well, we see anybody regardless of ability to pay. That doesn't really deter providing service, but because more people are coming insured under Medi-Cal, we're seeing more Medi-Cal patients.
Fernando.
Thank you, Reymundo, for being such an impactful warrior in bringing health to an underserved community. You've been a huge, huge difference in the health of our community. The question that you raised about the mobile van that's sitting there for 2 years, I think that's an easy fix, because if the mayor and all of our city council were to hear or to read that particular problem, I think that problem would go away. So thank you.
Okay.
That's right.
Question here. What is the difference on this versus the school health clinics that exist?
They're the same. They're community health centers. They're just in a different mode. So
different mode. Okay.
Yeah.
And if I might tie that into, this is a vicious circle of challenge to health in general, and my focus being around youth and kids particularly. Is there any way that those connections relative to improved school health clinics and the access of children and their fitness and health in school could or should be elevated to, because basically physical education is a joke in most schools, and we're not requiring that in the educational system for students for all the years. It's crazy that there's an imbalance in focus in that, but are these clinics something that could help in that way somehow?
Well,
Bridget.
I think that's about the built environment. That's one of the social determinants of health, right? You have to feel safe in your environment. You have to be able to exercise, especially like if you have diabetes, part of your regimen is exercise, right? And if you can't feel safe going out, then there's a problem there. So to the extent that those issues are addressed, we can support, because it's hard to take the lead on advocacy, but we do have some health centers that maybe would be willing, I would assume, to at least discuss that and see what they need to do to try to make that happen. But there are the school-based health centers of Santa Clara County that is one of the 10 corporations that I mentioned.
Mike.
All right, a former banker here, a numbers guy. I was looking at your financials, and Efren isn't here, so I have to ask you. So you show net income of 5,000,003, 21, 6,000,003, and 22. Where does that 11 million of net income go? What are you investing in?
The School of Arts and Culture. We just bought the building in January. So our money goes into to provide additional services where we can. That's this is an exception to the rule. Normally, we're just like in the black about $1 million, which sounds a lot, but for an $80 million corporation, that's not a whole lot. These were exceptional years, and we took advantage of the support and the help, and we maintained as much as possible our productivity. There was a point in time where we had to lay off 150 people because we were losing $250,000 a week, because of the pandemic. But we brought them all back, at least 91 of them, because the other ones had either found alternative employment or didn't want to return. But these were exceptional. So our board just said, let's invest it. Let's create more. And I think the School of Arts and Culture is the correct investment, because again, they're going to be building a campus that will begin hopefully to address many of the needs of the East Side. And their goal is to make it better for the community that's there.
Any other questions? All right, well, thank you, Reymundo, and thank you, Emily. Fantastic job. Good. Best wishes on your retirement, and if you feel like you need, to get active in the community, we've got a place here. All right, this is great. Okay, so I've got a couple of post-speaker announcements to make. Janica Clem reminded me, or gave me a little tug to say, hey, during that block party, if there's anyone who was an alumni of Leadership San Jose, the program she's in charge of with the Chamber of Commerce, they're having a reunion at Open San Jose, where Zanato's used to be on 2nd Street. Tech Shop used to be there. It's now Create TV's Open San Jose space. They're having a reunion during the block party. So if you're going down, you can stop by there and catch up with some old friends. I've also really enjoyed, and I hope some of you enjoyed the firesides we've been having this week. Last night, I was lucky enough to be at Larry and Carmen Stone's to see their art collection at their house. I saw a Salvador Dali. I saw a Pablo Picasso. I saw a Jerry Silva. Not art, just actually Jerry was there. So there's another one coming up tomorrow. I'm looking forward to seeing a lot of you there too. So thank you to the Fun and Friendship Committee for all their help in organizing those. Next week, our speaker will be philanthropist Al Castellano on a lasting impact on the Latino community. Hope to see you guys then, and please bust your tables until we see you. Let the good times roll.